All right, so some 700,000 healthcare workers are still waiting to be vaccinated against COVID-19. Earlier this week, the Health Minister assuring us that they will actually get them jabbed by the end of the week. Of course, a few days later, admitting this wouldn't happen this week. Of course, as well, on Monday, the country entered phase 2 of the rollout, which focuses on those aged 60 and older. Our reporter Heidi Giokos joins us for the latest. Hello, Heidi. So you've been to a number of vaccination sites this week. Now, on day 5, what's your assessment of how it's going?
So, Sally, we know that Phase 2 and Phase 1B kicked off on Monday, and of course there were some glitches that were reported with regards to the electronic vaccine data system not being able to pick up those registered, and of course the National Department of Health being able to actually count exactly how many were vaccinated on day 1. We do know that every day there's a statement that's released in the evenings with the COVID-19 numbers and vaccination numbers, and we know to date over 119,000 have been vaccinated under Phase 2. We have been to a number of vaccination sites with a lot of them saying that they don't have enough vaccinators or they are waiting for people to come in. Some were unaware that they weren't allowed to be accepting walk-ins and only those that have voucher numbers. But what's interesting here is that we've been to Chris Hani vaccination site where we do understand that they do accept walk-ins, and the reason for this is because they cater to a very large community. It's one of the biggest hospitals, and of course their vaccination site has over 16 vaccinators, so they are accepting walk-ins, and it seems as though their process is running quite smoothly. They also do have enough vaccines to cater for the demand and for the amounts of people that have registered, gotten an appointment, and also the walk-ins. Let's listen to the district manager from the hospital.
We are satisfied with how things have been going. We managed to vaccinate the elderly from 60 years and above from Monday, and the turn-up has been so good. And we also managed to vaccinate the remaining healthcare workers. So the process is running smooth, as you can see. Today we've got 12 vaccinators, and each vaccinator should vaccinate at least 40. So it means we're targeting 480. So we are scheduling them for appointments, but we are also accommodating walk-ins as well.
All right, so how do we know that we've got public sites and privately run sites? Of course, those sites aren't just inoculating sort of private healthcare members. But I'm wondering, having looked at both of them, are they comparable? Are they both as efficient?
Yes, certainly, Sally. I must say that there were a number of vaccination sites, public vaccination sites rather, that we were at over the last couple of days where there were serious issues. For example, no chairs for those that had, for the elderly that had gone to those vaccination sites. But today we decided to go to Discovery, where we also know that there was a glitch on the system and they started accepting walk-ins, and we do know that there was an influx of people, Phase 2, those 60 and above, that wanted to get vaccinated. But just assessing on the ground what's going on, we do know that they've now added an extra vaccination site on the first floor. The one is on the ground floor, the other one is on the first floor. And we do know that they are trying to facilitate and make sure that there's a smooth process. But what's interesting about Discovery is that they do not accept walk-ins. They only accept you if you have a voucher number, a clear appointment date from the electronic vaccination data system, and they also don't require you to pay for the vaccine. If you have medical aid, it will go through your medical aid, but it doesn't necessarily mean that if you have medical aid, you'll only be able to get the vaccine at Discovery. They're also opening additional sites as of Monday, and we do know that it might also be in Cape Town, and they'll look across the country where else there is a need. But it's critical for Discovery, Dis-Chem and Clicks to facilitate this process with government to get this national rollout plan as quick as possible and to vaccinate the elderly. We do know that that deadline is 5.5 million, possibly by June. But let's listen to what the CEO of Discovery Health had to say on that.
We vaccinate whoever arrives here with an EVDS voucher and a booking. They must have an EVDS voucher when they arrive in order to get vaccinated. I guess standing and walking around on the floor, the truth is the majority of the people that we see are the elderly, but we do see some young people in amongst them, and they must of course be healthcare workers who are also eligible during this phase. I don't have firm statistics of the proportion between the two. The majority, I would say, are elderly at this stage.
So that's really interesting. We know that earlier in the week that Discovery site had to take walk-ins because there was a glitch with the system, but it sounds like they've ironed all out those problems out, and now it's all very much on a booking system, which of course means that you wait less and you don't have as much contact with people in a communal area. So Heidi, a little earlier you said that under phase 2, which of course is the over 60s, and as you say, there's over 5 million that should be vaccinated, ideally by the end of June, 119,000 vaccinated in 5 days. So that works out to just shy of 24,000 a day. We know that we've got to ramp up to 250,000 vaccinations a day. Of course, we also know that a lot of sites are still going to come on board. So that's phase 2, the elderly. What information have you been able to glean about phase 1B? Just the context, of course, Johnson & Johnson's eNCA program, that was for 500,000 healthcare workers. There's still 700,000 healthcare workers desperately need that jab because they are on the front line. They are at risk. How many of them have been vaccinated this week?
Well, that's a question, Sally, unfortunately, I don't have an answer to, because we've actually reached out to the department, the National Department of Health, to get clarity on why their statements, when they send them out in the evening to update the country on COVID-19 numbers and vaccinations, why it does not include phase 1B, which is critical to know how many healthcare workers we still have. If the health minister is saying that there's a deadline for over 700,000 by the end of this week, and then goes back and says that's unrealistic, what does that look like? We know that this communication has just dropped from Gauteng Health that speaks to how many vaccination sites there are, how many old age homes have been targeted. As you can see, 11 old age homes as of Monday, 24 vaccination sites. We do know specifically in Gauteng, over 50,000 doses of the Pfizer vaccine has been allocated to Gauteng since the commencement of phase 1 and 1B and 2, and it just speaks further to the total of people that have been vaccinated. Now, that number is critical because it's not as of 20 May. It's actually as of the start of eNCA specifically in Gauteng. It also speaks to how many people have registered on the electronic vaccination data system as of 20 May. In Gauteng, it's just over 350,000 rand. Now, what's interesting in the next graphic that's going to come up is how many vaccinations have taken place as of 20 May. You can see that Gauteng is, of course, leading, with KwaZulu-Natal next, and then the Western Cape. We do know that there have been issues in the Northern Cape because there are only 2 vaccination sites for phase 2. That is a big concern that the department has to deal with. But again, this document does not speak to how many healthcare workers have been vaccinated or support staff under phase 1B. This is critical information that the National Department needs to speak to and address, because we need to know how far we are off with those 700,000 that still need to be vaccinated. And what is this going to mean, Sally, with regards to the vaccines we have in the country and those that have already been vaccinated under phase 1B and phase 2, and them needing to go and get their second jab? Are they going to be enough? Are we catering for the demand of those that want to get the jab and those that have already for their second jab? So that information is critical, and we hope the department is watching and they'll be able to provide that information for us.
Absolutely. And Heidi, very quickly, what's happening in terms of vaccinations over the weekend?
We do know that certain vaccination sites will operate over the weekend. We know an additional couple of vaccination sites have opened up. We know initially it was only 87. By the end of this week, the minister did say there will be over 200. So vaccination sites are opening up, which speaks to the fact that they are trying to get as many people vaccinated as quickly as possible to make sure it's over the weekend. And when the elderly can actually get to vaccination sites, that is critical as well. And hopefully we'll be able to get further information on when those over 1 million Johnson & Johnson vaccines will be released from the Eastern Cape, because that's going to also speak to a further mass rollout of our vaccine program in the country.